I'm looking at the hospitalization numbers. They're 2.5 times what they were in your December 30th news conference. I'm looking at projections related to where the deaths are likely going, according to the epidemiologists, and Saskatchewan is on the rise. I guess the question to ask, and you've said that you don't want to have the same measures as elsewhere, but who bears responsibility if these projections, if these continuing hospitalization rates continue to rise? Do you bear responsibility for the outcome of that, which could theoretically at least be the same as the Delta wave?
Omicron is ultimately, and COVID is ultimately responsible for what we're seeing in Saskatchewan, across Canada, and around the world. We're we continue to find ourselves in a global pandemic, and we continue to, you see, and if you're referencing some of the modeling that was released last week, we've often said it's a tool that ultimately Dr. Shahab looks at, as well as I think the Minister of Health and others are constantly looking at the modeling among other pieces of information that are ultimately being channeled into the decision-making process. I think the modeling last week had said somewhere between 750 hospitalizations are in that neighborhood. Is that correct? We had modeling, in late December that was provided that indicated we'd probably be looking at 4,000 hospitalizations by mid-January, 2,000 in ICU. That's starting to be refined as we, and this is maybe to Jeremy's question earlier, as we find and learn more about how Omicron has, the Omicron variant has, impacted other areas of not only Canada but other areas of the world. I think as we go through time, the modeling becomes more concise, and ultimately, the decisions and the tools that we have available to us become. We try to leave those in place that are proving to be effective, like the access to vaccines, like the mandatory masking, like the access to rapid tests here in Saskatchewan. We encourage people to avail themselves to all of those tools. And when you look at Saskatchewan's numbers, and even if you say we're a few days behind or a week behind other areas of Canada, Saskatchewan's infection numbers, Saskatchewan's hospitalization numbers still remain some of the lower numbers across the nation.
You have a follow-up question, Murray?
No, I'll repeat my question in just a different matter for perhaps the answer that people are looking for. Obviously, Omicron is responsible or the reason people are getting sick, but government policies preventing the spread of that is what is in play in terms of the question. You're suggesting that it doesn't work here. It doesn't work here because it hasn't worked elsewhere, according to your thesis. Again, the projections elsewhere, national modeling, suggest that deaths are on the rise everywhere and will rise sharper in Saskatchewan. If that is the case, and if we have an opportunity to prevent that, and have an opportunity to prevent that through added measures, added restrictions, will you bear responsibility for the added cases?
The consequences of added measures need to be under consideration, as well, as we have been through a very long, what is close to 2 years now, where people in Saskatchewan, maybe to a lesser degree than other areas of Canada, but people across Canada as well, have been, subject to a significant public health measures that have been put in place and remain in place today. And there will be, and there is consequences to those measures ultimately being in place. What you're seeing governments do across Canada and including the Saskatchewan government is to put forward and make available all of the tools that are ultimately effective in lowering our case counts, and then ultimately effective in turn in keeping our hospitalizations at a manageable level and as low as they ultimately can possibly be.